We're back on Inside Tennessee along with John North, John Becker, and let's get to our panel and questions about mental health care in East Tennessee. Susan?
Yeah, 2 or 3 things. Do we have any idea what the cost is going to be? Have you figured that out? Have they? Do you foresee a standalone facility like we had at Lakeshore? Do you see it broken out into several different units? What do you see happening here?
The good thing is that we can make it what works best. So I think it will be the Department of Mental Health working with our community providers and our community leaders to say, okay, what works best? It doesn't necessarily have to go in Knox County, although the majority of the largest number of people that have been transported to Chattanooga are from Knox County. So it's got to be in Knox County or really close to Knox County. But I think at this point, we don't really know, because you don't know what the cost will be, the land cost. You don't know if you get a building and you retrofit it or what that's going to be. But I think there'll be conversations going on. I think there are already probably people thinking and brainstorming, and I think that's what we'll do. I'm better on strategy as far as trying what we need to do to get it positioned where it needs to be. I'll let the folks that are better on what it's actually going to look like and the cost, I'll let them do that.
Timetable?
Best case scenario would be we would get the administration to say, okay, yes, we do need it. We're going to put it on our list, and maybe we'll give you X number of dollars to do the planning and the preliminary designs and start or buying the land or something like that.
It's safe to say it'd be at least 5 years before a door would open on something like this.
Probably, but I will continue to advocate for this. I will continue to corral my peers that I work with in the legislature, so we have not just me or the Knox County folks doing it, but all of them. Can you imagine the folks up in Bristol that are having to transport folks to Chattanooga? That's a long haul. Right. It's long from here, but.
So, Becky, this is one of the things that we do agree on, and I appreciate the work that you've done.
We probably agree on more than you think.
Well, but there are a few, that's correct. But now in hindsight, and I often tell people, hey, we don't have a time machine, so don't worry, but you've been there since day one, essentially. You took office literally as Lakeshore was being closed. Looking back now over those 12 years, did we make a mistake?
I don't know. We were 50 people were living in a hospital that were living there long term, and I do believe a smaller living situation is better. The model in mental health supports was going more toward community mental health treatments. We were treating 3,000 people, less than 3,000 people a year. We're treating 90,000 people a year. We don't realize how much that has impacted those lives that we wouldn't have been able to do. So I can't say it was an absolute mistake, but I think we learned from it, and I think we know how to move forward better. So this is the hand that's before us, and I'm going to make the best of it and do what I can. So
one follow-up question is related.
Sure.
If we took the federal Medicare, Medicaid supplement that the state legislature, and you haven't been necessarily in support of not accepting that, but would that help this situation? Would those dollars make a difference in mental health care within our community?
It could. It depends upon how those waivers were written. So
you got the right waiver, though. It certainly could, couldn't it?
It could on some of the people. I don't know that it necessarily would on the people that are really being hospitalized, that are getting inpatient care, because they're safety net people, and those are uninsured that we're covering anyway. So I can't totally answer that question, but I do, like you say, I have supported some sort of an expansion, because I do think that we need to make sure we're helping as many people as
It certainly
possible.
wouldn't hurt us.
It wouldn't hurt.
Just quickly, historically, lots of our viewers have no doubt seen One Flew Over the Cuckoo's Nest. And that movie really brought mental health care to light, in that we were institutionalizing people who shouldn't necessarily be in an institution and could function in a place that you're talking about. Explain how our thinking as a culture has evolved on mental health treatment in East Tennessee and beyond.
Well, I think for years you didn't talk about somebody that had mental health issues that needed, whether it was mild depression or it was schizophrenia. I mean,
There was
and
a
everything
stigma.
in between. There was a
Yeah.
huge stigma to it. There was the stigma to people that had intellectual disabilities, and they were warehoused basically, like up at Green Valley. So I think people realize that no, it's no different than a physical illness. It's really in the same realm there. So I think now people are open about it. And so I think that's changed. I think we realized that some of the barbaric things they used to do in mental health treatments, the shock treatments and things like that, were
Isolation.
They're
Yeah.
just torture. But even probably around the time Lakeshore was closing, the people that were there probably couldn't make any choices for themselves. You know, whether it's like they couldn't decide what they ate.
Yeah.
You know, or, you know, they just didn't have a lot of freedoms.
That was their last stop, really.
Yeah, I mean, it pretty much was for the ones that were living there full time. So I am a big supporter of community mental health homes for people that need long-term care. But I think what we're missing right now is that middle segment. You know, we've got the short-term stays, whether it's at Moccasin Bend or whether it's at Peninsula or some of the others, Ridgeview. But we don't have something that takes care of somebody for 3 months, 4 months, 5 months that will stabilize them, get their medicine stabilized, and get them to a point that they could live in a community mental health home with 24/7 round-the-clock supports, but that would help them with their meds and all their daily living skills and things like that.
All right, we're going to take a quick break on Inside Tennessee because we're going to talk more about the legislature and other things that are on your agenda. Just this note, if you want to read that report, you can go to the Senator's website or ours. You can see the full layout. And we'll be back on this Sunday morning. Happy Easter.